Hello, everyone, and welcome back to Day 7 of the Virtual Iowa Governor's Conference on Public Health. We're so happy that you've decided to join us today. Welcome to those of you who are new, and welcome back to those of you who've been with us for several sessions before. My name is Lena Tucker-Reinders, and I'm the Executive Director of Iowa Public Health Association. I'm grateful you've decided to join us today for these two presentations that we have, and I hope that you'll continue to meet with us daily as we learn from and support our public health colleagues around the state. As you know, we usually meet in person for the Iowa Governor's Conference on Public Health in the first week of April each year, but coronavirus and COVID made us pivot and make other plans. And I was just sharing with our presenters that one of the benefits of this is that so many more of us get to hear the presentations that we normally would have had to decide back and forth. Do I go to this presentation or that presentation? So because we've had to pivot and we're going virtual and we're getting used to Zoom, we can learn from so many more of our colleagues. And all of our presentations are being archived on the IPHA YouTube channel. So any that you've missed, you can go back and listen to as well. Like I said, I'm the Executive Director of Iowa Public Health Association. We are one of two of the primary planning partners of the Governor's Conference on Public Health, the other one being Iowa Environmental Health Association. We are both nonprofit membership organizations, and we rely on members and donors to be able to provide you the work that we do, including educational experiences like this. I strongly encourage you to become a member of IPHA or IEHA and support our mission to unite and strengthen the voice for public health in Iowa, which is exactly what we're doing today. I also want to thank the sponsors and exhibitors of the virtual Governor's Conference. Their commitment to public health in Iowa is paramount, especially in these times. The sponsors of the virtual conference are Aetna, Amera Group, Unity Point Health, and the University of Iowa College of Public Health. And our exhibitors are ACES 360, CHAMPS Software, Des Moines University, Healthy Hometown, Iowa Corn Growers Association, IDPH, the Bureau of Chronic Disease Prevention and Management, and the Midwestern Public Health Training Center. These are all the folks that you would have visited at their tables had we met in person, and I encourage you to check out their websites and learn more about the great work that they are doing to support public health. Before I introduce today's speakers, just a reminder that everyone is on mute, and I'm asking you to communicate with us via the chat function. The chat will come to only me and the other presenters. It won't go to everybody live, and that way we can ward off any potential Zoom bombers. We haven't had a problem yet, and I hope that continues. At the end of each presentation, there will be time for questions. So please, again, use the chat function or the Q&A button at the bottom of your screen. I will take the questions and then relay them to our presenters. Today's conference is, today's second presentation is eligible for CEUs for CHES, dietetics, and nursing. If you would like to have those CEUs for today's session, please go ahead and type your name and which type of credit you'd like and your number in the chat box, and we'll be sure to follow up. You'll also need to complete an evaluation form, and you can find the link to that on the conference website available at iowapha.org. Okay, so today's first presentation is about Double Up Food Bucks, a great program that is encouraging healthier eating. And our presenter is Aryn McLaren of Healthiest Initiative. So I'm going to go ahead and turn it over to Aryn.
Great, thank you. I'll start sharing my screen here. Thank you for tuning in to learn a little bit about Double Up Food Bucks. This was originally slotted as a poster presentation, so very excited to be able to speak about our program and answer questions. My goal of today's presentation is just to inform you about where Double Up is right now, what we're doing to serve the state of Iowa, and then kind of our future plans and projections of where we want to go next. So let me, the Double Up Food Bucks program in Iowa is led by the Iowa Healthiest State Initiative. If you're not familiar with the Healthiest State Initiative, we are a 501c3 nonprofit with the mission to improve the physical, social, and emotional well-beings of Iowans. Double Up Food Bucks has been part of the Healthiest State Initiative since 2016, and we lead that program for the state of Iowa. We provide technical assistance to all of the Double Up Food Bucks sites, and we manage all of the program funding for the Double Up Food Bucks program in Iowa. If you're not familiar with Double Up Food Bucks, it is a nutrition incentive program which incentivizes specifically the purchasing of fruits and vegetables. So in order to participate in the program, you must be participating also in the SNAP program for the state of Iowa, and that is the federal food assistance that is offered here for the state of Iowa. So when a customer goes and uses their SNAP EBT card to make a purchase, we match that shopping dollar 1-to-1 with a Double Up Food Bucks up to $10 per day. So every time they shop, they can earn another dollar to get free fruits and vegetables. We have a fairly wide diversity of sites now. We started in farmers markets in 2016, and since then we've been able to expand that, to grocery stores, farm stands, mobile markets, and it looks like potentially we may be looking at online retail sales, something that's become very prevalent with the new COVID-19 happenings. So how this program works in farmers markets is, in Iowa, currently we only have the ability to use Double Up Food Bucks at farmers markets that are on and using a token system. And so a customer would come to the central information booth at a farmer's market, ask to use their EBT card to spend dollars at the farmer's market that day. So they may indicate a specific dollar amount that they expect to spend. The market would then swipe their EBT card for that dollar amount and give them an equal amount of tokens that they can use throughout the market to do their shopping. At that same point in time is when they would also be given the Double Up Food Bucks script up to that $10 matching limit. So then they're able to go throughout the market redeeming both their EBT dollars and their Double Up Food Bucks dollars. We in turn reimburse the farmers markets and the farmers directly for those Double Up Food Bucks dollars that are spent at their farmers market. It works a little differently in the grocery stores. In the grocery stores, we require that the customer shop for produce in order to earn the Double Up Food Bucks dollars, and that's simply to limit some of this EBT spending that may be done on candy or sugar sweetened beverages, things that the Healthiest State really does not want to help promote for consumption in the state of Iowa. So in the grocery store, the customer can use their SNAP EBT to purchase produce. At the time of purchase at the point of sale system at the register, they would then be earning the Double Up Food Bucks. So for example, in Fairway, one of our participating grocery stores, their register is programmed to know that if a person makes an EBT purchase and it also has eligible fruits and vegetables, the register automatically calculates what they would be eligible for in Double Up Food Bucks and pops that up, so the cashier then knows to hand that customer up to $10 in spending. So if they only purchased $7 of fruits and vegetables that day, they would be given $7. If they purchased $20 in fruits and vegetables with their EBT card, they would be capped at that $10 limit. Then those Double Up Food Bucks cards can be spent on their next visit to that grocery store, or they can also be saved and used at a later time or at a different location. So these Double Up Food Bucks currencies that you can see right here on this slide are interchangeable between all grocery stores and farmers markets in the state of Iowa. In 2019, we saw sizable growth when we added 14 participating Fairway stores. So you can see the growth that occurred from 2016 to 2019. And this year we expect that trend will probably continue with the increase in SNAP participation due to COVID-19 happenings, and also with the continued awareness and promotion of the program. The 14 Fairway stores were added about mid-year in 2019. So these statistics would show about 6 months worth of grocery shopping, not a full calendar year. So one of the common questions we have related to grocery store spending is, does that take away from the farmers markets because, those dollars then are going into Fairway stores and not at the local farmers markets? And we actually saw that that was exactly opposite of what was happening. All of the Fairway stores that were included in the program, excuse me, were added to cities that already had a Double Up Food Bucks farmers market running. And so what we saw was that the redemption at the farmers markets went up with the addition of the grocery stores. People were earning their Double Up Food Bucks dollars at the Fairway grocery stores and then going and visiting the farmers market and spending more Double Up Food Bucks dollars there than they had in the previous year. So 14 out of the 15 farmers markets ended up redeeming more Double Up Food Bucks dollars than they distributed. So those farmers were able to make more money from Double Up Food Bucks spending than they had in previous years. An example would be, the first one would be Decorah Farmers Market. They participated in Double Up Food Bucks since 2016 and have redeemed anywhere from maybe $100 to $200 in Double Up Food Bucks annually. Last summer, they redeemed over $1,500 in Double Up Food Bucks. And so that was, number one, a great success for their farmers, but also we believe that it's a great success for the farmers market in general, because we are hope that that means new customers are visiting their market that may not have been aware that they could spend SNAP EBT at the market in the past, or had just learned about Double Up Food Bucks at the grocery store and now learning that they can also spend it at their local farmers market. And then you can see that the same type of shopping pattern happened at a very different market, West Des Moines Valley Junction. So a much larger and urban market compared to Decorah. So we really use this win-win-win philosophy as the cornerstone for the Double Up Food Bucks program. We want families to bring home more healthy food. We want farmers to increase their sale and have farm profits in the state of Iowa while keeping those local, those food dollars local in the economy and helping to strengthen the communities, especially like rural communities in Iowa. And we believe that we are doing that based on feedback we've received from Iowa farmers that have participated in the program. You can see here a few with their feedback. Farmers are first and foremost very pleased that they're able to help members of their own community that may not otherwise have the access that they need to fresh, healthy fruits and vegetables, all while also being able to maintain and support and grow their own businesses. So every year we do survey and evaluation of customers and vendors. So we try to kind of identify who our shoppers are and who is utilizing Double Up Food Bucks. And this is what we found based on last year's survey. It was over half have children living in the home, and of that, 44% have 4 or more children in the home. 72% of the shoppers for Double Up Food Bucks that responded were female, and kind of that 25 to 50-year-old range. But there was around 25% that were 55 or older. And we know that the program is having a positive impact on shoppers on both their purchasing habits and their consumption of fruits and vegetables, while also decreasing maybe behaviors that are not quite as healthy of potato chips, candy, cookie consumption. In the farmers markets, we also offer SNAP education at the Central Information Booth, which is very helpful, and they provide produce basic sheets on a monthly basis. So depending on which produce is in season, they'll have information in English and Spanish on what those fruits and vegetables may be, how to prepare them, how to preserve them, some recipes that they can try at their house that all come from the Spin Smart, Eat Smart website created by Iowa State Extension. So very budgeted for a low price point. So this map shows currently the green square counties are where we currently have Double Up Food Bucks representation in the state of Iowa. We have asked the state of Iowa to appropriate $1 million to the Double Up Food Bucks program to help with expansion. And those shopping carts indicate where we plan to expand if we are awarded the $1 million to support the program. This is how we plan to expand. We have in the past done the participation by a little bit of volunteer basis of communities that could get organized, that had the resources to support the program. But at this point, with state appropriated dollars, we need to look at a little bit different expansion strategy. And so we went through and scored all 99 counties based on 3 factors, and that was the number of Iowans or percentage of Iowans receiving SNAP benefits in that county. So, but you can see if it was greater than 15 to some, more down in that 5 to 8 range. Then also percent of food insecurity and the percent of obesity in that county. And so then based on those 3 scores, each was given a number 1, 2, 3, 4, 5, 6, or 7. And then that will give them the ranking of where they fall in the expansion plan. And so these, I believe there's 14 counties here, would be the next 14 counties that either scored a 1 or a 2 based on that ranking criteria and are kind of starred for being of the priority. And of course, within here, we can rank these 14 as well. So Fairway does have the ability to quickly turn on the program in stores. And so with nothing more than just training cashiers on how to use the program, it's then the Healthiest State Initiative's job to reach out to these counties and make sure that we have the relationships with community partners and community resources so that obviously the consumer knows where and how to access Double Up Food Bucks. So the way that we have decided to move forward with grocery expansion while also keeping mind of local procurement requirements of the program and that support of the local farmers, we are requiring grocery stores to submit submit procurement documentation to us through the months of May to October. And every year that they participate in the program, we will ask that they increase their local procurement sales by 1%. And so currently, we define local as within 250 miles from the point of its origin or within the state of Iowa. And we have been very tuned into conversations with Reefaswig and other partners, IDOLs in the state of Iowa, talking about the need for maybe a more concrete definition of local. And if that were to come up, we would be more than happy to be on board with that. But at this point, this is what the Double Up Food Bucks program is using. So ways that we try to really, communications is um, a very necessary thing to get the word out, to educate consumers on how to use the program. And at the same time, unfortunately, just because of the model of our program, most dollars are earmarked for the actual incentive. And so we do have a limited budget for communications. But this is some of the ways that we found to be the most effective. We do a variety of signage and wayfinding signs for both the market, and we ask grocery stores to use their own in-store marketing resources, but provide the logos and the artwork that they can use. We also create tear sheets every year that are double-sided, very basic statewide information on Double Up Food Bucks, what it is, how to use it in a grocery store or a farmer's market. And we have, last year in 2019, we distributed roughly 10,000 of those among community partners with participating Double Up Food Bucks sites in their communities. Social media has been a great resource for us and has a high ROI. We've noticed that doing paid social media advertising on Facebook was highly effective. We can target zip codes and specific demographics and really get engagement and be able to respond back and have some communication that goes beyond just handing out a flyer. So that we have looked into more this year, and we'll continue to expand on that. We have a website that lives on the Healthiest States webpage, a webpage that lives on the Healthiest States website, excuse me, and that does get quite a bit of interaction. We also provide instructional videos, and we were fortunate enough to have Alliant Energy actually create us a promo video for Double Up Food Bucks that was aired at the World Food Prize last year. So that was a great asset that we've been able to use. Otherwise, press releases and sometimes press conferences with Governor Reynolds have been a great way for us to inform the public about what's going on. Opportunities for us for funding are very fortunate enough to have USDA funding to support programs that have nutrition incentives similar to Double Up Food Bucks. So we have been a recipient formerly of the FINI program. That was a Food Insecurity Nutrition Incentive Grant. That has now been updated to the Gus Schumacher Nutrition Incentive Program, or GUSNIP, in the 2008 Farm Bill. Essentially the same with a few minor changes, but overall they match any in-kind funding from state, private, or local dollars that we can get one-to-one with federal dollars. So that is not, you don't find a one-to-one match all too often. So we feel fortunate for that, and we try to utilize that resource as much as we can. We are allowed to run simultaneous grants. So you may get awarded a 3-year grant in 2018, and you could still come back and reapply the following year for another grant. So the Healthiest State Initiative was awarded a 3-year FINI grant in 2018. And so we are just getting to the final stages of that grant right now. And we will plan to apply if we can get enough match funding for either a mid-size $500,000 or a large-scale $1 million grant requirement. Our initial hopes was that we would be able to meet that $1 million grant requirement with state funding this year. But because of the delay in session, I don't believe that we will have any answers to that in time to meet the funding deadline of May 16th. So we may have to look at either postponing a year or applying for a little bit smaller funding level. But we do hope that we can continue to move forward with the state funding request to support Double Up Food Bucks. We have support from partners in Iowa, United Way, Iowa Heart Association, and we'd ask that if you help educate your local representatives on the program, giving the opportunity, we would appreciate it. Because really, when we are talking to a lot of the legislative community, many are unaware or don't know the program, or may not just quite understand exactly how it works and how it benefits both local economies, farmers, and the low-income populations of Iowa. So sharing that win-win philosophy with them can help us in just educating and promoting the program in Iowa. And at this time with COVID-19, high rates of unemployment means high rates of utilizing the SNAP EBT program in Iowa. And so this program becomes even more necessary than ever and important in making sure that Iowans are being able to have a healthy lifestyle, eating the healthy foods for their families, and also making sure that our local produce farmers are also being able to sustain their livelihood, because we aren't sure right now on the status of what farmers markets are going to look like, if they're going to be able to be there, you know, selling their produce, because they need to make sure that they're staying healthy. So these things have become even more important now than ever. We do get private financial support for the program through Bank of America, Amerigroup, Alliant Energy, ITC. We just learned that we will be getting some funding from United Healthcare. They do a Medicare Advantage plan here in the state of Iowa, so that was good news that we recently learned. That is it for my sharing of our program. I'm happy to answer questions, and wanted to share my contact information so you can reach out that way if you're more comfortable.
Thanks, Erin. Great information. And, you know, we used to share office space, so I'm familiar with Double Up Food Bucks, and it's great to see the increase in utilization, and hopefully that will continue. We have a couple questions that have come in. One of them is talking about expanding. You mentioned your priority areas, but this person is wondering if a local community were to secure local funding, would there be opportunity to expand into an area that was not designated a priority area?
Yeah, that's a great question. So let me just talk a little bit more. So right now, due to funding, we have pretty much frozen grocery expansion. And we are still, because of just the amount of dollars it takes to support a farmer's market being much lower, any farmer's market, we are encouraging to still apply regardless of their county or location within the state, where we want them to apply, and we're happy to work with them and get them involved. But as far as grocery expansion occurs, if the community themselves can come up with the funding to support it, then yes, we can turn that on out of the expansion strategy we have. But the expansion strategy is more for using state funded dollars to expand the program.
Great. The next question kind of gets back to the availability of the program, and the person's wondering how you can find out if your local grocery store is participating.
Yeah, so
I suppose.
Yeah, so this website that's on the screen now, iowahealthieststate.com/double-up-food-bucks. If you go there right at the top is find a location. I would just suggest clicking that, and then there's a full listing of all participating sites and their website, or how they would like you to learn about their location.
Great. The next one here is wondering about nutrition, cooking, kind of the preparation, education. Mm-hmm. So it's great to have people to purchase the food, but then how do we make sure the food is put to use and not wasted?
Yeah, so we have partnered with Iowa State Extension SNAP Ed education since 2016, and we've tried a few different things throughout the years, doing on-site cooking demonstrations, booths at the farmers markets. Unfortunately, those didn't get as much interactions as we were hoping, and you have to be very careful about food preparation in those environments. And so we have found that really the most effective way that we can interact with customers is at that central information booth when they come to swipe their EBT card, because they are already face to face with the information booth staff, and they have the SNAP education material laid out on the front of the information booth with produce basics. So those are information sheets that Iowa State Extension makes for in-season produce that's available at the farmer's market, how you would pick it, like how you would select the right produce, how you would prepare that produce at home for consumption, or also to like how to preserve it if you're looking for preservation. And then they also supply simple recipes that can be used with in-season produce. They also hand out general information in regards to the Spend Smart, Eat Smart website, which is a great resource for consumers in Iowa if you want to shop healthy but on a budget.
It was muted. Okay, the next question here is about farmers markets. And they're wondering do you train all the vendors at a farmers market, or is there a centralized booth that has a Healthiest State staff person, or is there maybe somebody designated at the farmers market that has training, or how does that all work?
Yeah, so we work directly with the farmers market. So because we do use the token and Double Up Food Bucks script system, it does all originate at a central information booth. So the Healthiest State Initiative, we have tried to work with some technology to work with direct marketing farmers. So that would be individual vendors who are processing EBT. Unfortunately, we haven't come up with a successful solution to that yet. And so we really do work with farmers market staff who are at these information booths to train them. That being said, when we bring on a new farmers market, I am very involved in getting everyone up and running and getting everyone trained. And so I will typically go to a farmers market vendor meeting at the beginning of the season in that March, April timeframe, and present to all of the vendors, answering questions. We also supply all of the vendors with Double Up Food Bucks 11x17 vinyl signs and some sheets on just education, frequently asked questions and things like that regarding the Double Up Food Bucks program. So we do try to provide that training up front, but ongoing, really it is put into the hands of the farmers markets and their staff. And then I can work with those one or two staff people ongoing instead of every single vendor.
Great. Oh wait, here we go. One more. Where do we request flyers or tear-offs for clients?
Yeah, I would say feel free to just shoot me an email. My email address is Aryn@iowahealthieststate.com. I believe it's still up on the screen right now. Or if you are on the iowahealthieststate.com website, we have just a general inquiry button there. So either one would be fine, and we can get some supplies or some marketing materials sent to you.
Great. Well, this has been a great conversation, and I'm sure as hopefully this spring, this summer, sometime this fall, we'll all be able to venture back out to our farmers market, and I'm sure we'll all start noticing those signs and opportunities for people to eat more healthy foods. So thank you for your work. As a reminder, this presentation will be archived on the IPHA YouTube channel, and there will be a link to Erin's slides in the description of that video. So thanks again, Erin.
Thank you.
Yeah, and next we're gonna go ahead and transition to Kate LaFollette with Telligen. And Kate is going to discuss the management of the spread of C Difficile. I told her I would not try to pronounce the full bacterium name, but C Difficile in Iowa's acute care hospitals and nursing homes. So with that, I'll turn it over to you, Kate.
Thank you very much. Let's see. Can you see my slides?
Yes, and before Kate gets started, I'll just remind everybody that this is the presentation that is available for nursing and CHES credits and dietetics, I believe, as well. So if you need those credits, please go ahead, and if you haven't already done so, put your name and number in the chat box, and I will also provide the link to the evaluation form. So back to you, Kate.
Very good, thank you. Thank you for inviting me to speak today. A lot has changed since we submitted our slides. I want to talk just for a second about Telligen and who we are. We used to be called the Iowa Foundation for Medical Care, but as we, as a company, gained more states and more contracts, we had to kind of develop a name that was all-inclusive. And so Telligen is now what used to be IFMC. But the other thing, Telligen has many, many contracts in many, many states. So if you hear Telligen in different contexts, if you're talking about Medicaid, maybe an employee health program, there's lots of things that we do as a company. But the contract that I work on is called the QIO, and that stands for Quality Improvement Organization, Quality Improvement Network. And every state gets a QIO. Everybody gets one. We're all equal. So Nebraska has one, Minnesota has one, Missouri has one, everybody gets one. And we're funded through the Medicare Trust Fund, the Medicare Trust Fund. So everything that we provide, everything that we do is free to those we serve. And what we do is we're responsible for improving the quality of care for those who choose to work with us or those who volunteer to work with us. It's a lot of long-term care facilities, physician offices, hospitals, public health, home health, and organizations like that. And the QIO contract is a 5-year contract, so it's a really long engagement. We have, 5 years of skin in the game, so it's not a one and done kind of relationship. And I'll talk more about how we do that at the end. So when I was going to do this in person, I was going to have people stand up because it was the end of the day. But since we're virtual, that's kind of even more fun. If you want to just type into chat maybe what your role is, whether you're a nurse or a social worker or a dietitian or some other entity or background that might be of interest, that might help me adjust my slides and my talking points if I need to. And while you're doing that, my disclaimer is that I am not an infection preventionist. I'm a nurse, I'm a registered nurse. I've been a nurse for 28 years, and I have a lot of quality improvement background. So I'm a subject matter expert on quality improvement. I spent most of my nursing career in long-term care, skilled care, adult med surg, and in the outpatient clinic setting. But my role at Telligen has been primarily and will continue to be care transitions. So whenever we move patients or people from a hospital to a nursing home to home, but even if we move them among specialties, so a family practice doctor that goes to a cardiologist, or a patient that goes to a family practice and then goes to a cardiologist, we need to make sure those people are talking to each other. I do a lot of community coalition building. This is helping communities come together and kind of be a neutral convener to help them identify their goals and develop a plan for that. And we also do a lot of connecting of partners in communities. So having said that, we're going to talk about C Difficile, and Erin had really pretty slides with lots of pretty fruit, and I do not have pictures on mine, and that's probably going to be a very good thing. Our objectives are very high level. I want people to understand the drivers of C Difficile and antibiotic stewardship, why it's important. Reasons for diarrhea other than C Difficile. Develop an action plan focused on some of these drivers. By addressing the drivers of C diff, we can drive that, we can decrease that infection. And then understand the impact of C Difficile on reimbursement. So I'm not sure how familiar people are with C diff or C Difficile infections. It's kind of taken a back seat with COVID-19 being more prominent. But I think it's going to be nice to hear about something other than COVID-19 for even just 20 minutes. So Telligen and COVID-19, CMS has asked us to redirect our efforts from community coalition building, care transitions, unplanned readmissions, to focus wholly on COVID-19, infection prevention, and telehealth. Infection prevention is so important, and I'm learning that there's so much that we need to do more education in the public for infection prevention. With COVID-19, we're just trying to keep people up to date on this information that changes so quickly and daily and even hourly. So we're trying to help people stay on top of what the recommendations are. And as far as telehealth is concerned, in the past, telehealth has been poorly reimbursed and it has not been used a lot in the healthcare settings. Since the pandemic started, they expanded the use of telehealth. And so that means that people don't have to go into the physician office to be seen or to talk about symptoms or concerns or things like that. And it's going to be reimbursed at a much higher rate. We're still working out kinks with telehealth because not everyone in the state has access. They might have slow internet, or they may not have a computer, or they may not just have the technology skills to do a telehealth visit. All right. I like to start out with it's a case study, basically. It's the clinical side of what happened to somebody. But I'm also going to tell the rest of the story. So I'm going to talk about Mary, who's a 64-year-old female. And a year ago, back in March, she had a sinus infection. So she went to the doctor and she got some antibiotics. And then 2 weeks later, she had a tooth abscess and she went to her dentist and she got antibiotics. 10 days after that, she had her dental work done and got more antibiotics. Several days later, she woke up with uncontrolled diarrhea, vomiting, fever, and chills, and she tested positive for C. difficile infection. Her physician treated her with Flagyl, which is a common treatment, but when she stopped taking it, the symptoms returned, and then she was referred to a GI, a gastrointestinal physician, who again tried Flagyl, and the symptoms returned when she stopped. And then we got out the big guns and she tried some vancomycin. But through all this, it took her almost 10 months from her initial illness to recover, 10 months to recover from C. difficile. So that's the clinical picture. Those are the facts and the figures. But I want to talk a little bit about the impact on Mary's life. From a social aspect, she missed the arrival of a grandchild, which is a big deal. She missed her husband's retirement party. She missed a lot of work. And while she's insured, she still had co-pays and she still had deductibles to meet, and it was very costly. But in addition, she ruined sheets and mattresses and some of her clothes, and she had to, replace those things. And there's no monetary figure we can put on how it made her feel. She felt trapped and she felt like she couldn't be anywhere, and she was embarrassed and she was scared to go out in public. So if you've ever had C. difficile, or if you've taken care of somebody that's had C. difficile, if we have time at the end, I want to hear about your story, because I'd like to hear about what went well and maybe what could have gone better. So because I'm a history buff, I'm going to tell you a little bit about the history of C. difficile. It was first discovered or identified in 1936 in a stool of a healthy infant, which I don't know what they were looking for, but they found that. But it wasn't until 1978, all those years later, that C. difficile was associated with a disease process. And it was in the 90s when research led to the discovery that C. difficile causes antibiotic-related diarrhea. So it's been around for a while, and we're just now starting to get a better grasp of it. So there was a study that was done and I think it's referenced there, people that get C. difficile tend to be white, female, less than 60 years old, 65. I'm sorry, greater than 65. And those are all things that we really can't change. We don't have a lot of influence. It's everything else on the list, the socioeconomic things that we have the ability to impact. So living under the poverty level, living in crowded conditions, low education, low income public assistance, and unemployment. Now, the thing that I did not like about this study is there was no reference to rural and how ruralness affects the different socioeconomics and disease process. And I was so rural that we really need to have a good grasp on that. The other thing that it didn't talk about was race and ethnicity. I'm not sure what the demographic was that they studied, but those are things that I found troublesome. But if you look at the socioeconomic list here, again, these are all things that we have some control over. So C. difficile is most likely to occur in people 65 and older who take antibiotics and receive medical care, people that stay in hospitals and nursing homes for a long period of time, and people with weakened immune systems or previous C. difficile infection. So if you have C. difficile once, you're at high risk for getting it again. And I want to really note here that C. difficile isn't just a hospital thing. It doesn't just happen in the hospital or the nursing home. It can happen to anybody. It happens a lot just in the community, but we don't always know about it. We don't always test for it. So the best thing to do is let's not get C. difficile at all. So let's talk about preventing C. diff. The ways that they've really identified, and the CDC has done a lot of work on this, is antibiotic stewardship, rapid and accurate identification and diagnosis, and prevent transmission. And we're going to talk about each one of these elements in the following slides. But there was another study actually done in Iowa, and it was in clinical setting. So it was a hospital, skilled nursing facility, long-term care. And some of the gaps they found, some of the processes that they found that weren't working, that they could have fixed to prevent this, was nurses didn't always discontinue antibiotic orders when they didn't make sense. Or they treated the lab test instead of the patient, so they treated a positive result instead of a patient with symptoms. And they also tested for cure, which is never ever recommended, especially with C. difficile. So antibiotic stewardship is really a multidisciplinary team that comes together. It's made up of leadership, and you need the leadership commitment. They have to be on board. This has to be important to the people leading your organizations. Accountability. Hospitals right now are required to report any C. difficile case that is positive. They report it into the NHSN database, which is the National Health Safety something. I can't think of the other words, but they're required to, by law, to report those. Nursing homes are not. Home health agencies are not required. Physician offices are not required to report. So that kind of limits the accountability and the reporting part. Pharmacy expertise. This is really a multidisciplinary team. If you don't have a pharmacist on your antibiotic stewardship team, you need one. This is what they went to school for. This is what they know. They know drugs. And it can't just be a coffee club. You have to actually do stuff if you have an antibiotic stewardship program. Tracking is, you can't do anything unless you measure it. So if you're going to start an antibiotic stewardship program, tracking is where I would start. You have to know how much of a problem you're dealing with. How often does it happen? Does it happen everywhere? Does it happen seasonally? Does it happen in one floor or one wing of a building? Things like that. And then I mentioned reporting and education, and I think this is where we have not done a great job of educating our public. People are still asking for antibiotics when they have a virus, And unfortunately, they're still getting those antibiotics for a virus. They don't help. They're not going to work. They're going to put you at risk for a C. difficile infection. So these are the different kinds of tests you can do for a C. difficile. But before we get there, before we even take the lab test, let's see if we need it. So things that would make you wonder if, I wonder if this person has C. difficile. If they have diarrhea, more than 3 stools within 24 hours, and diarrhea is not about frequency, how often you go to the bathroom, it's about consistency. What does the stool look like? Is it formed? Is it liquid? Is it runny? Is it watery? Those kinds of things. Have there been any laxatives taken in the previous 48 hours? Has the person had any oral or IV contrast or CAT scan dye within the previous 48 hours? Are they on tube feedings? Tube feedings are notorious for causing diarrhea. Are they taking an antibiotic currently? Have they taken one in the last 8 weeks? And the other thing that we've learned is that a proton pump inhibitor, so like Nexium, Prilosec, Prevacid, those kinds of medications also can predispose you to a C. difficile infection. So I'm not going to talk through each one of these tests. They all have different positive things about them and different things that we wish we could change. I think what's really important here is that you know where you're sending your stool samples to, what lab you're using. It's important that you know what kind of tests they're using. And the easiest way to do that is just pick up the phone and call the lab, and they'll be able to tell you. All right. Instead of having C. diff and treating it, we want to prevent it. So contact precautions, that's glove, gowns, mask if you think there's going to be a risk of splashing. Come back to hand hygiene. Environmental control and cleaning. A C. difficile is a spore, so it's not killed by an antibiotic. It's like a little hard seed, and it can only be removed mechanically. So soap and water for your hands will remove the C. difficile. It doesn't kill anything, it just removes it from your hands. And therefore, on inanimate objects, you know, countertop, doorknob, pin padded cases, you have to use a sporicidal, something that's very specifically recommended for removal of spores. And it's resistant to extreme temperature. So even if it's really, really hot water or really, really cold water, or you freeze it, it doesn't kill the spore. It's still there. And the thing that I think I found most shocking when I very first learned about C. diff years ago is that it can live up to 5 months on inanimate objects. It can live decades in the soil. That's why we don't eat dirt. So if you think about going into a hospital room or a nursing home or visiting a loved one that's in a facility of some kind, that bedside table, if it hasn't been washed, it could be carrying C. difficile. The phone, the doorknob, the light switch, any of those things can harbor a C. difficile spore. And now that I've scared everybody, I'm going to talk about hand hygiene for just a second. And I know we've been hearing a lot about hand hygiene. You know, everybody wash your hands, COVID-19. But I want to show you this video because I found it to be very interesting. Let's see if I can pull it up here. Now, there's no sound to this video because it's from Norway. It's a Norwegian Institute of Public Health. And all it is it's just this guy, and you want to scream at him to wash his hands. But there's no sound, so it's just they type some words on the screen. Sorry. Using gloves, good thing. We're happy about that. So he still has his gloves on, but he's touching everything. So the orange here, the colors that you see indicate potential infection spread. He didn't wash his hands. So at this point, I'm screaming, please wash your hands. Stop touching things. Stop touching things. Stop touching stuff. Go wash your hands. So that's the end of that. Gloves do not replace hand hygiene. I'd like to believe that we all know that, but I think we sometimes forget. I know before we started today, we were talking about kids and getting their hands washed, and it's hard on the skin. I've also done a little bit more research on hand washing. 15 seconds. It seems like it's not very long, but if you sing happy birthday twice, you'll realize how long that is. The areas most missed when we wash our hands are our thumbs, our fingertips, and between our fingers. So the next time you wash your hands, think about how you're washing them and maybe pay more attention to some of those spaces. The other thing is that C. difficile, the spore, is not killed by hand sanitizer. So hand sanitizer is good in a pinch when you need to, but soap and water is always better. The cost of C. difficile, it costs almost $24,000 to treat each person with C. diff. And if the infection recurs, it's an additional $10,000. Most of this money is spent within the first treatment or within the first episode of illness. Hospitals, third-party payers pay between $9,000 and $11,000, and society as a whole lost work time, lost clothing, washing, disinfectants, things like that can be even higher. So if you think about Mary, yeah, she probably didn't pay $10,000 out of pocket to be treated, but it took 10 months of her life. So back in 2015, value-based purchasing began, and that's when they said to hospitals, if you guys have central line infections, urinary tract infections, or surgical site infections, we aren't going to give you as much money. Medicare is not going to pay you as much money for you having these sorts of infections. And then in 2017, they added MRSA and C. difficile to that list. So the state of the state in Iowa from 2018 to 2019, that's our fiscal year, that's Medicare's fiscal year, 24 hospitals in the state of Iowa were eligible for the penalty. And those are our larger hospitals. They're called the fee-for-service or pay-for-performance hospitals. That's like your Mercy, Des Moines, and Unity Point, and some of those big hospitals that are in our state. So of the 24 hospitals, 10 out of 24 have been penalized 1%. Now that's the maximum penalty that you can get for this. And it doesn't sound like a lot, but if you take 1% of whatever your operating margin is and throw it away, somebody, a CPA somewhere, this is giving them chest pain. Critical access hospitals are exempt from the penalty because they're not fee for service. And also there's a indirect impact on nursing homes. If you have someone in the nursing home with C. difficile, you're at high risk for unplanned transfers, readmissions, pressure ulcers, illness, things like that. So I do want to talk about the nursing home perspective just a little bit. There was a nursing home study, and here's a link if you want to read more about that. 28% of residents with C. difficile had been hospitalized 7 days prior to diagnosis. So a quarter of people, basically. Of those people with C. diff, 76% had received antibiotics in the 12 weeks prior. So if you're thinking, you know, a week or two out from antibiotics and you're safe, you're not. It's 12 weeks. And we've talked about this, 65 plus. The average age of the nursing home resident in this study was 82. And of those who died within 30 days of a C. diff diagnosis, 90% of them were over 65. So this is really, really hard on our elderly. So I think as I wrap this up, prevention is always the best strategy, using antibiotic stewardship. And even if you're not maybe in a direct healthcare setting, if you're not working in a hospital or a clinic or things like that, I still think there's a role for all of us as a community to really emphasize proper use of antibiotics. So every person gets optimal antibiotic treatment, lab tests, so we aren't giving out antibiotics for viruses because they don't help. Communication, if you're going from like a nursing home to a hospital, of course, a transfer form, but even if you're in the outpatient setting, your doctor needs to talk to your pharmacist. The pharmacist needs to understand and know that, hey, I've been to a cardiologist or I've been to a gastrointestinal doctor. So making sure that everyone's in the loop is good. Preventing infections, I'm a big proponent of vaccines. Let's vaccinate, vaccinate, vaccinate. There is no vaccine for this because it's not a virus. But still, if you have a weakened immune system, there's a lot of, it's just an invitation for trouble, I think. Now, the important thing here is that I would never say don't ever take an antibiotic. I don't agree with that. There are absolutely times and places for antibiotics, but let's make sure we're using the right antibiotic, whether it's wide spectrum or narrow, gram positive, gram negative. Make sure we're using the right dose. Are we giving 500 milligrams when 250 milligrams would do? And the right duration. Do they need it for 10 days or do they need it for 5 days? And I think from a community standpoint, I think what we can do is to talk about, and the CDC has a lot of information on this, to talk about how we don't need an antibiotic at every whip stitch. We don't, for every little cough and sniffle, no antibiotic. You may need to go to the doctor and they can manage your symptoms, but we've gotten really dependent on asking for those. So we talked about the drivers of C. difficile and antibiotic stewardship. I gave 2 reasons for diarrhea other than C. diff. If you're going to start an action plan to prevent this or start antibiotic stewardship, start with data. You need to know what's going on, how often is it happening, and where. And then I also talked about the impact of C. difficile on reimbursement. It's a pretty spendy event. Lena, if the questions aren't too hard, I can try to field them.
Okay, hopefully this should work. We do have one that's come in during your presentation, and I welcome everybody else to start typing questions into either the chat or the Q&A box, and we'll read those to Kate as they come in. This question is about insurance reimbursement, so that's kind of what you ended on. But this person is wondering what Iowa law allows for insurance reimbursement as far as telehealth services provided by a registered and licensed dietitian. if you know that. She says, she expands and she says, I know Medicare is not allowing it, but I believe Iowa insurance law is very vague on this. As in particular as it pertains to Medicaid and commercial health plans. Do you have any experience?
I'm going to have to do some work on that one. That's a great question. I don't know the answer to it though. I'll find out.
Okay, I'll provide you the name of the person, and then maybe you can follow up directly. How's that sound?
Okay.
All right, great. Any other questions coming in? I think.
Well, people are asking.
Go ahead.
Nina.
Oh, I was gonna say, here's one. Are the schools for providers addressing the problem with prescribing antibiotics?
So what I can tell you anecdotally is that there has been a big shift in how we train our physicians, nurse practitioners, physician assistants, and we still have this older generation of physicians that, you know, they're big on the antibiotics because they were lifesavers. You know, when antibiotics first came out, you know, were proven, they worked, they saved lives. But this new generation of physicians, they're getting to be quite hesitant to really prescribe an antibiotic, especially if they know it's a viral illness. So there's specific illnesses that they say don't give antibiotics for. And one of them is a sinus infection, upper respiratory infection. Those are likely viral, and it's better to let them play out and manage your symptoms that way. So hopefully we're getting another younger generation of forward-thinking medical providers.
Right, I agree. Just from personal experience, I took one of my daughters in for what turned out to be an ear infection, but luckily my kids I have 3 kids, and between them, they've maybe suffered 2 ear infections in their lives. So this one threw me for a loop, and I took her in, and the doctor just started to write me a prescription for antibiotics. And I asked him, I said, how do you know it's bacterial and not viral? And he stopped, he put his pen down, he said, you're the first person that's asked me that. He said, if it was my kid, I'd give him Tylenol and send him home. So yeah, hopefully we're seeing a change in provider behavior in that regard as well. So yeah. So yeah, I think I don't see any other questions coming in. I think you've done a great job explaining how this all works and the importance of controlling it. And that video from Norway was quite something. And it's so pertinent to C diff and so many other areas of cross-contamination as well. So, with that, I'll just thank you, Kate, and Erin as well, still on the line. Thank you to all of our attendees for your thought-provoking questions. It's so great that we can continue to learn from each other, even though we're at a distance. So please join us every day at noon for what would have been our breakout and poster sessions at the Governor's Conference. Be sure, I'll share my screen with what's coming up next week. Not next week, I'm sorry, tomorrow. Hopefully we can see that. Okay.
Yeah.
Okay, good. So tomorrow, unfortunately, Lynn will not be able to join us for the pertussis outbreak. She is a bit under the weather, so she won't be able to join us. We'll see if anybody else can present her slides, because I know that's an important topic. We have Aubrey Alvarez talking about expanding food access, and then Mike Bell on creating healthy places. So join us here tomorrow. Join us every day for the next week and a half as we share lessons learned and best practices from our experts around the state. And be sure to check out the presentations you missed on the IPHA YouTube channel. This one should be up in the next day or two, and the slides that the presenters use will be linked in the description of the video. And as we always sign off, just a reminder that we are all social distancing, but we are still together. We're still a network, and we are still colleagues dedicated to public health in Iowa. So thank you again, everybody, and stay well, and we'll see you tomorrow. Bye.